Today we will discuss about the axillary lymph node. We already dissected the pectoral region and we reflect the skin of the pectoral region as well as inside the head and neck. First of all, I will reflect this is the fat over the pectoral muscles. This is the pectoralis major muscles. We have reflected. Just below to the pectoralis major, you can see this is the pectoralis minor and it is pierced by the medial pectoral nerve. So, and this is the axilla, this is the medial wall of the axilla, this is the lateral wall of the axilla, and this is the base of the axilla, and this is the apex of the axilla. This is the anterior wall of the axilla, which is formed by the pectoralis major and minor. The posterior wall, which is formed by the subscapularis muscles on the posterior wall. We already discussed this is the anterior wall, which is formed by the pectoralis major and minor muscles of the axillary wall. This is the medial wall, which is formed by the 3 to 4 upper intercostal space, which is covered by the intercostal muscles as well as upper part of the serratus anterior. This is the lateral wall where there is a humerus and it is covered by the triceps muscles as well as there is a axillary vessels and there is a brachial plexus. This is the base of the axilla and it is formed by the axillary fascia and there is a part of the posteriorly there is a latissimus dorsi muscles. Posterior wall of the axilla, this is the posterior wall of the axilla which is formed by the subscapularis muscles and along with its scapula. Apex, it is the most upper part. It is also called the cervicoaxillary canal. From the cervical region to the axilla, the structure which goes inside. I have already cut here the clavicle and you can see this is the part of this is the subclavius muscles and this is the axillary vessels, this is the vein and this is the artery. Today I will discuss about the axillary lymph node. This is the first lymph node. It is over the lower border of the pectoralis major muscles. It is the anterior group of the axillary lymph node. Anterior group of the axillary lymph node which receives the lymph from the pectoral region as well as on the outer quadrant of the breast which receives the anti-axillary lymph nodes. The other lymph node just behind to the anti-axillary lymph node inside the lateral wall of the axilla, this lymph node, it is the lateral group of the axillary lymph node, and this lateral group of the axillary lymph node which is along with the basilic vessels, it is the continues as a axillary veins. So the lateral group which receives the lymph from the whole of the upper limb except the lymphatic which is drained along with the cephalic vein, whatever the lymphatics which is received along with the cephalic vein which is open inside the deltopectoral lymph node. This is the deltopectoral lymph node. Here you can see this is the deltopectoral lymph node. This is the deltoid muscles and this is the pectoralis major muscles and this is the deltopectoral lymph node. So lateral group of the axillary lymph node, here you can see this is the lateral group of the axillary lymph node which receives all the lymphatics from the upper limb except the cephalic vein. Just behind to it there is a group of the lymph node. Here you can see these are the group of the lymph nodes. I have reflected from the posterior to it is the central group of the lymph node as well as there is a lymphatics along with the subscapular vessels. Here you can see this is the subscapular vessels and lymphatics posterior group which lies along with the subscapular vessels, while the central which lies at the base of the axilla between the lateral group and posterior group. This is the central group of the axillary lymph nodes. So all these lymphatics from the anterior group, from the posterior group, from the lateral group which is drained inside the central group, and this central group ultimately drain into the apical group of the lymph nodes, and apical group of the lymph node which is drained inside the subclavian group of the lymph nodes. Posterior axillary lymph node which lies along with the subscapular vessels and nerves, and this lymphatics, here you can see this lymphatics which receives the lymphatic from the posterior abdominal wall. Here you can see this is the posterior abdominal wall till up to the iliac crest. All this posterior group which is drained inside the posterior axillary lymph nodes. So ultimately anterior group, lateral group and posterior group which is drained inside the central group, and central which is goes inside the apical, and apical which is goes inside the subclavian group of the lymph nodes. And the deltopectoral lymph node which is receives the lymphatic which is along with the cephalic vein. So this is about to the lymphatic drainage of the axillary lymph nodes. Whenever there is a carcinoma of the breast, we always remove this axillary group of the lymph node for the radical mastectomy. To removal of the breast, it is called the mastectomy. So you have to remember the axillary group of the lymph node which is we have removed whenever we can do the remove the breast, it is called the mastectomy or carcinoma of the breast. At that time we can remove the axillary lymph nodes. Second thing you have to remember, the axillary lymph node through the lymphatics, it is spread to the opposite side of the breast. So through the lymphatics, the carcinoma of the breast of the one side which is spread to the opposite side of the breast, you have to remember. And through the venous plexus, the carcinoma of the breast which is through the vertebral venous plexus which is spread to the bones as well as inside the lungs and everywhere inside the body. So you have to remember. So this is about to the axillary lymph node. Hope you enjoy the lecture. Thank you very much.